Hello, how are you? And welcome to our presentation on keeping patients connected during the COVID-19 pandemic. I'm Dr. Noor Ramji, and I'm joined by Dr. Deborah Kopansky-Giles, and we're from the St. Michael's Hospital Academic Family Health Team. In March 2020, we were faced with the worldwide COVID-19 pandemic. Our team learned very early on that and understood that our patients that were vulnerable would be more vulnerable to the physical distancing that was required when it came to their health, as well as social determinants of health. We struck the COVID working group from our Social Determinants of Health Committee to apply a health equity lens to COVID pandemic care. We had multiple activities, and today we will hope to highlight the wellness check-in calls as our first call to action. The purpose of the wellness check-in call was to provide outreach to our family health team patients who may be at higher risk of decline in their health and social determinants of health when physically distanced or in self-isolation. The purpose of the call was to keep patients connected with our family health team, to make sure that they were aware of how to keep safe during the pandemic and aware about symptoms of the COVID-19 illness. We also wanted to make sure that our patients were connected with interprofessional health resources, such as their social workers, pharmacies, as well as chiropractors, services that were often somewhat closed during this time. We also used this opportunity to collect information from our patients about their concerns to help inform our own advocacy efforts. We did this by recruiting 18 interprofessional healthcare providers from our family health team, as well as the family health residents, who went through a list that was generated from our electronic medical record who we identified as requiring extra support. They used the support of 10 subject matter experts in various fields, as well as the support of a social determinants of health resource document that identified community resources that were up and running to serve things like food, housing, income security during this time. We connected with over 2,000 patients at the family health team by the end of August. And you can see early on in April, the highlighted concerns for our patients were often associated with medical, mental health, and seniors care. As the pandemic progressed, we could see that our top concerns were still mental health, medical, and seniors concerns. However, more and more of our patients had started to become more and more resilient to the effects of the pandemic.
In addition to collecting data about patient concerns, we also wanted to know what action steps arose out of each of the calls. And from this graph, you can see the blue section talked about when we closed a call. That meant that the patient didn't have any concerns. They were well supported in their environment. They felt that they didn't require any specific information, and we did give them a dedicated telephone line to call if they needed to afterwards, but we were able to close that call. And we did see that the great majority of patients were quite comfortable in how they were managing COVID, and they were aware of COVID protocols. We also collected information about patients' perspectives, and those patient perspectives were quite as you can see from the chart here, the patient's perspectives were that they're very, very satisfied with the calls, and they actually enjoyed connecting with the department providers. We also were really interested in finding out how the callers experienced this professional activity that was really unique and outside of their normal daily activities in clinic. And you can see from the orange and dark blue bars that they were really highly satisfied themselves, and they found it was a very positive experience. And only in a very few number of cases was the experience not a positive one for our callers. So in summary, we're really excited that we are able to reach over 2,000 patients in this first several months of the COVID pandemic. They were really happy with the service and they felt connected to the team. That was really important for us. We also found that even from us as staff and providers, we felt really strongly valued by our patients, and we also felt happy with and enjoying that professional enhancement of our roles. And from the perspective of the department, we were able to collect a lot of additional information from patients. We saw the strengthening of our team. We were able to utilize and implement the new COVID toolbar, as well as resource guides for our patients and our providers. And we really found that we were able to now have a good plan going forward for future pandemic planning. We want to thank this amazing team that worked with us over the past several months and continuing forward on the great work they did with this initiative. And thank you so much for stopping in to see us at our poster, and don't hesitate to contact us if you need any more information. Thanks.